introduce Candice Roc. Candice Crystal Roc is a lawyer and senior manager director, member in good standing of the Law Society of Ontario, with over 20 years of experience in the public sector, working in the fields of human rights investigations, training development and delivery, Indigenous self-government and fiscal negotiations, emergency management, and tribunal operations management. Candice holds a BA Honors in Human Rights and Law, a civil law degree, a Juris Doctor, and a Master in International Affairs and Diplomacy. She is passionate about human rights, disability awareness, and is dedicated to removing barriers to accessibility. And with that, I'm going to turn it over to Candice. I'll be managing her slides, so you'll hear a brief pause during her presentation asking me to change the slides, just so everybody knows.
Thank you so much, Kaylee. Does everyone hear me well? Because I have to use this headset today due to massive construction outside. Okay, perfect. Thank you so much. You know, thanks for being here today, and Kaylee, thank you for inviting me, because I, truly am passionate about this topic for many reasons. We can go to the next slide, because I will repeat the disclaimer. I have to. So yes, I will be presenting around the duty to accommodate in the workplace, and a few housekeeping items, disclaimer. So, just a reminder that this presentation is meant for informational and educational purposes only. I'm not providing any legal advice in this context. If you face a specific workplace situation or employment dispute, please consult your legal counsel, or if you are unionized, talk to one of your union shop stewards or contact your union, okay? The goal of today is, really to provide tools, tips, and best practices, and a general overview of the duty to accommodate in the workplace, using migraines and headache disorders as, real world examples or practical examples. So I should also explain as well that I'm going to be talking about the Canadian context. So I know there are people in attendance from the States. I'm assuming some of the best practices I share will be practical for you, but they may not apply in the American context, because there's the American with Disabilities Act. We don't comply with that legislation. So there are different practices in the American context. Another thing to keep in mind, I'm going to try my best to give you all the tools, best practices, but the reality is that to train somebody who's already a specialist in delivering these kind of sessions takes 5 full days to train, 5 full days from 8 to 4, p.m. And to be a specialist, it takes between 5 and 10 years in this field. So this is not to equip you to start delivering training. It's really to give you tips and tricks on how to have discussions with your manager, possibly, or your supervisors, and also your doctor or healthcare practitioner. Next slide, Kaylee, thanks. So the objectives of, this presentation, first and foremost, I feel that this topic matters for a lot of reasons. If we don't accommodate appropriately employees, there's a risk of exodus, and there's also a risk of progression of condition. Because if you're forced to continue to work in a situation that is not supporting you, it can deteriorate your condition. So the benefits of accommodating includes better work productivity, possibly a reduction of symptoms regarding the condition, and also less complaints. So there's a benefit to the employer as well from that perspective. Also, this topic personally matters to me because I also suffer from a chronic migraine condition. And I personally deal with migraines that have deeply impacted my quality of life and even some of job opportunities. So I feel it's important, in the last few years, I learned to equip myself better to have these discussions with my own managers and supervisors. And it is something that, I can speak from experience that, often migraines are misunderstood. There is bias and stigma with regards to this condition, and especially within the duty to accommodate context. So that's why, as you can see, the objectives of the presentation deal with, you know, uh, you know, providing you with a basic understanding of the legal foundations of the duty to accommodate, explore unique nature of migraine and headache disorders in the workplace setting. Also discuss how to communicate functional limitations to your employer and your healthcare practitioner. Really important as well, reviewing roles of employees, employers, and healthcare practitioners, and also unions if you are in a unionized environment. And at the end, we will discuss promising practices and practical case examples. Next slide, Kaylee. So this slide may take a bit more time, but it's really to make sure that everyone's equipped with basic knowledge around the duty to accommodate. So I said legal foundations, but there are also practical foundations. In terms of the definition of disability, there are several. A lot of case law will define disability a bit differently. There's provincial human rights legislation, federal human rights legislation that define disability, but the one that I primarily use is found within the Accessible Canada Act. And I should note that provincial and federal differences do occur, but the main concept is there. So it's something that you can use moving forward. So the definition of disability, it's any impairment, including a physical, mental, intellectual, cognitive, learning, communication, or sensory impairments, or a functional limitation, whether permanent, temporary, or episodic in nature, evident or not, that an interaction with a barrier hinders a person's full and equal participation in society. So that's a pretty big definition. I know that it sounds complex, but I'm going to try to simplify it right here. If you notice, there's a shift right now, even in Canadian legislation that used to be what we call a medical model of disability towards a social one, about how society is creating barriers that impair us or disable us. So it's less on the focus of the person with their condition, but more on what barriers are being created in the workplace and the physical locations, etc. So in addition, it's important to consider that disabilities can be permanent, temporary, episodic, chronic, all part of migraine and headache conditions as well, or disorders. So that's something to really consider. So in terms of the duty to accommodate, what is that? Well, in simple language, it ensures that employees with disabilities are supported to perform their work duties. It's a legal obligation on the part of the employer to ensure that any barriers present in the workplace, whether physical workplace or remote workplace, if you telework or work remotely, are addressed unless it leads to undue hardship to the employer. So I will explain what undue hardship means in a few minutes. It's important to mention that it's a shared responsibility between the employee and the employer. And the employer is only legally required to meet the accommodation needs of the employee, not the wants or preferences. So I'm going to go through this in more detail later on, but it's important to know that just because you want something to be done, there may be needs that can be met that the employer feels is reasonable in terms of accommodation, and legally that is permissible, okay? Employers are expected to assess each case individually, given the unique nature of each person's condition, and not make blanket assumptions or create blanket or general policies on how to deal, and I say that within brackets, with persons with disabilities or employees. There are obviously exceptions to this, and this is what's really important to talk about. Undue hardship. Undue hardship means that an employer may not be in a position to accommodate an employee if there are excessive costs associated with the accommodation, or that it may lead to health and safety risks to the employee or others. So there has been case law around that. What is meant by health and safety? Well, in one situation, there was a case where an individual had a beard for religious purposes, okay? But they also had a safety security position where if they worked in a chemical plant, so they were responsible to shut down all the systems, but they had to wear a mask, which they couldn't wear appropriately. So the employer and the courts found that in that case, and this is many years ago, but it's an example, in that case that even though, you know, an accommodation could, you know, for religious purposes is usually offered in the workplace because the individual couldn't shave their beard for religious purposes, but that there was such a huge risk to the health and safety of others and himself as well, that it was considered an exception under undue hardship. Sorry about that. So that's one thing. In terms of case law, which also is really important. These are the two foundational cases with regards to duty to accommodate in Canada. They're called the Marin and Grismer cases. And they clarify what a bona fide occupational requirement and justification are. In terms of employers or service providers can claim that a specific job requirement is necessary and that it can impede on somebody's human rights with regards to disability. What I mean by that is most jobs can be accommodated, but there are jobs that cannot. I give the example of somebody in a security position. If you're in the military, you're part of the RCMP or border services. If you're completely blind or have some sort of visual disability, it may be a situation where the employer cannot accommodate you, because how are you going to use firearms in those safety security positions, right? So that's what a bona fide occupational requirement is. It's rare, but we see it in healthcare. We see it in certain positions where, you know, the employer can try to accommodate, but in most cases cannot because of the nature of the work. So it could be that you may be in some of these positions. And if that's the case, it may be more difficult to accommodate you. So I also mentioned the social model versus the medical model of disability. So it's important to know that more and more employers are gravitating towards a social model that is human focused and focuses on functional impacts rather than medical diagnoses. So what that means is we're seeing in practice, and I can tell you in the last 5 years, there's been a big shift where less and less employers are requiring medical notes for everything. It could be that there may be a need for medical notes, but it's focused on having conversations with the employee and medical practitioner at times, but mostly the employee, to try to find solutions to barriers that may be present in the workplace. Okay, so I think it's really important to consider that when I talk about the, you know, the other slides. Next slide, Kaylee. Thanks. So I'm going through this rather quickly for, you know, an overview of migraine and headache disorders and unique challenges, because I think most of you have lived experience or have family members with these conditions and are quite aware of the impacts of such conditions, you know. But let's be clear, migraines are not just bad headaches. They're neurological. It's a neurological disorder that can create some pretty severe, you know, consequences or side effects, such as limb weaknesses, speech, hearing, and seeing distortions, and so forth. Yes, there's light sensitivity, brain fog, fatigue, pain that's often unpredictable, and all these systems can be episodic. They can be temporary, they can be chronic, they can be permanent as well. So it makes it a very difficult condition to kind of accommodate at times because of the unpredictable nature. there's also a component, the fact that it's non-apparent. So I'm sure you've heard the term visible disabilities. There's a transition away from using that term and referring to apparent and non-apparent conditions, because these disorders or disabilities can be or are often non-apparent. It does lead to more bias from colleagues and employers. I'm not saying that it's their fault. You know, if you're not familiar with a condition, you're going to base your opinions on what you know. And there's a lot of stigma around migraines, like I said, that, oh, it's just a headache. Take a Tylenol, you'll be fine, right? I'm sure many of you have dealt with that in some way during your careers. There's also stigma, like I mentioned, and bias in the workplace, and there's a fear of disclosure due to this bias. Some people are afraid of mentioning or having conversations with their supervisors. You know, the fact that these are variable, episodic or unpredictable symptoms, it can be difficult to articulate these conditions to your, manager, your supervisor, your employer, or even your medical practitioner. I understand the stress. Sometimes you have 15 minutes and you need to try to prepare to speak to your doctor or your neurologist. Sometimes it can be very nerve-wracking and difficult to articulate how these symptoms are impacting you. So that's definitely something to keep in mind. Yes, we can go to the next slide. Thanks, Kaylee. I could keep talking, but I know we need to keep it relatively short. So, okay, thank you. So this is the big part of the discussion regarding how to communicate functional limitations. But first and foremost, what is a functional limitation? So a functional limitation is something an employee cannot do or is limited in doing, or that it's something that impedes them from completing their job requirements as a result of their disability. It's important to note as well that employees in most circumstances do not have to disclose a medical diagnosis under Canadian law, but only refer to their functional impacts and limitations. I will go into more detail. What does that mean, obviously? But it's important to understand that you are not in most positions obligated to discuss or say that I have a migraine condition. You only need to explain that you have a medical condition and that the following functional limitations are what are creating potential issues in the workplace for you. When I say most, and this is what I'm saying throughout this presentation, these are general comments. There are always exceptions to these general statements, because like I said, if you're in a safety sensitive position, if you have to carry some sort of firearms, or people's lives are dependent on you because you operate a nuclear facility, the employer may have a right to ask more questions regarding your condition and may even require a full diagnosis of your condition. But in most situations, a functional limitation or impact is sufficient. So I'll give an example of what that means. So what would be a medical diagnosis or a medical-based statement? I have chronic migraines. I tell my boss I have chronic migraines. Whereas a functional limitation would be, I cannot tolerate fluorescent lighting due to a medical condition which triggers visual distortions that impair my ability to read or use a computer screen. Okay? Do you see the nuance there? I'm just wondering if it's clear that a functional limitation really refers to the impacts, like what is preventing me from fully and equally participating in the workplace like other colleagues are. what are those barriers I'm facing that prevent me from using the tools like everyone else are using or accessing the workplace freely. So an example of, tips to speak with your medical provider, because oftentimes from practice, and I'll speak from my, current role and in previous roles, sometimes, and it's not your medical practitioner's fault. This is not a topic that's often discussed in med school. I've been told sometimes they're given half an hour out of 4 years or even 10 years if you're a neurologist of school. But it's important to explain to them. So here are some tips I would give with how to communicate functional limitations. And like I said, they're examples. You need to find what the best approach is for your own needs. However, it could be that you highlight the requirement to your practitioner that they need to use functional language and not medical diagnosis when writing a note to the doctor. Another tip, and this has worked well for me too, from lived experience, is prepare ahead of time to think of the actual impacts the workplace is creating for your condition and what possible solutions can be applied. Try to brainstorm before meeting your medical practitioner on what are the true impacts, like what do I actually need? What kind of supports do I need in the workplace? What is preventing me from accessing the workplace effectively? So I'll give an example, and this is an example of how you can be specific. I need to limit screen time to X hours per day versus I get tired using a computer. And and I'll explain later on, it leads to, it's very difficult for an employer to figure out what the right accommodations are, or appropriate or reasonable accommodations, when information lacks specificity. So the more specific you are about, why you may need a flexible schedule or why you may need varying job tasks that aren't all on the computer, well, this limitation around X amount of hours of screen time, make it clear to the employer. Also, clarifying needs versus wants, okay? So I mentioned before, I'll give an example. I may want a diamond encrusted keyboard, but that's not necessarily legally meeting my functional limitations. My needs are that I need a special keyboard when I have dexterity or hand sensitivity issues, right? The color, you may have a color preference, but the color preference is not what's legally required. It's actually the functional restrictions. So I need X type of keyboard to prevent me from having symptoms. Okay, so for example, another one, a special screen may help your condition, but why? Why do you need that special screen? What limitation does it address? So these are little, tips and tricks to really help guide you through the process. Okay. I also mentioned tools. So I didn't provide links because it's mostly employers that have these. So if you work for an organization, whether small, or big, they often have functional ability forms or some sort of medical restriction forms, okay? So that's sometimes what you may need to use in your specific workplace. Some departments as well have accommodation plan templates that help you build an appropriate accommodation plan with your manager, supervisor, or the organization as a whole, okay? Next slide, Kaylee, thanks. So I'm going to talk about the roles and responsibilities. You may see some overlap. Some things I'm repeating over and over, but there's a reason for this. It's really important to kind of reflect on some of these statements. So you might feel there's repetition, but there's a good reason for this. So employees or patients, because if you're talking to your doctor as well, you have to, in most situations, participate in the accommodation process. It's really important to understand that it's not one-sided. It's a collaborative process. The law is very clear that both parties need to participate in good faith. If one side doesn't act in good faith, this is where union or grievances can be filed, etc. But I'm not going to go there. It's just, I'm talking about if everyone's acting in good faith, the employee has to engage in the in the process. I just need to take a little sip. It's also important to understand that an employee's accommodation needs must be met, but not their preferences. So I repeat this again. Just because you want something doesn't mean the employer has to give it to you. They just legally have to provide reasonable accommodations based on the functional limitations that are identified. Another good practice in terms of roles, responsibilities is if you're comfortable doing so, consider speaking with your supervisor about your needs. You don't need to share your specific condition, but if you're comfortable to do so, sometimes having these informal conversations facilitate the process. You might not have to go through this whole stringent, medical process. Having a one-on-one with your manager might be sufficient. They might be able to accommodate you on the spot. So it's worth having a discussion if you're comfortable. Sometimes a medical note is not required. It may be, it may not be. There's nothing in the law that says it needs to be or it has to be applied in all circumstances. And given that I mentioned before that we're moving towards a social-based model of disability, there's a huge kind of wave moving away from medical notes. Even some medical organizations are asking employers to stop requesting medical notes. So I think there's also pressures at the provincial level. I believe even in Ontario, for those in Ontario, I've heard that there's some discussions with the Canadian Medical Association and also the provincial one with regards to how medical notes are backlogging the system for practitioners. So something to keep in mind that it may not be required, especially if you're well prepared and have all the information. So what I mean by this is make sure to, communicate clear, constructive, and solution-oriented, wording. So make sure that you provide sufficient information to support the accommodation process. Specifically, what I mentioned before, what barriers am I facing in the workplace or at home? Why is it easier for me to work from home than in the workplace? Those kind of questions will help you brainstorm and figure out why are you potentially struggling in one workplace or one environment over another? Why do I work better in a closed office rather than an open floor concept? Those are the questions that can be asked by the employer and also will help you prepare. There's also a balance between protecting the privacy of an employee and the employer ensuring that the workplace is safe for the employees. So it can happen at times, and I'm just preparing, all of you to this. I'm not saying it happens all the time, but it's important to consider that if you say, for instance, well, I can't travel for work. Airplanes lead to exacerbation of my migraine condition. Great, the employee accommodates you, but then they can also ask, well, what do you do when you travel in your personal time? Are you still using, planes to fly, to travel, or have you just reduced all use of flights in your personal life? It's not that they're trying to impede in your personal life, but sometimes employers need to understand, what's working at home that isn't working in the office space, and how can they try to find ways to make it work for you in the office space as well. So just a little consideration that sometimes they can ask questions that may seem personal or impeding on your private life. Obviously, it has to be very limited, but it's something to prepare for that. And also frame requests based on functional needs, not personal preferences. So I'll give an example. A medical note from your doctor that says, Candice must work from home indefinitely due to a migraine condition, period. That is not enough. An employer has no obligation to necessarily respect that. And I'm not saying they won't, but they have a right to ask more questions because they need to know, why is it unsafe in the workplace? Is there something we can do to make it safe for this employee and other employees? It's important, like I said, why is this required? The employer can ask why this is required. The employer can ask what barriers in the workplace that the home environment can resolve, for instance. So usually more detailed notes are best. So this is why it's important that you try to, provide clear, constructive information to your employer and your healthcare provider. Also, if you are unionized, you can involve your representative in the process to support you, depending on the union. It's also important to know that duty to accommodate in Canada, so I can't speak about other jurisdictions, supersede collective agreement rights. So sometimes if somebody needs a flexible schedule due to their disability, it can impede on seniority rights under the collective agreement because human rights take precedence over unionized rights in most situations. Okay, next slide. Thank you. So the roles and responsibilities of employers, I kind of mentioned it in the other slide too. There is a legal obligation to accommodate until the point of undue hardship. So I referred to health safety cost. I gave the example of the person working in a chemical plant and, with not being able to appropriately use the mask because of their beard due to religious reasons. These are very exceptional circumstances. It's very rare that cost is used as an example, but it can be used in very small organizations. I've seen it in, trucking companies where there's 6 employees. Building a special workspace for somebody may cost $50,000. When it's an organization that is very small, it may be too excessive of a cost that could even lead to bankruptcy for that organization. However, an organization of 2,000 employees or 5,000 or 30,000 employees, it's much more difficult to use the cost defense in most situations. But like I said, it has to be reasonable costs, right? So 1 second, I'm just going to look at my other notes. It's important, and this is what I was referring to, that the employer conduct individual assessments. No stereotypes, bias, or assumptions. It's difficult. We're all human, right? We all have bias. For somebody to say that they're unbiased, that's not true, okay? But I'll give the example. It's possible to have 5 employees with the same condition that require 5 different accommodations. Why is that? Well, it could be that all within the migraine spectrum of disorders or disabilities, somebody may be fully functional at that point in time and can work from the office 5 days a week, no issues. Some people may need closed offices with reduced lighting. Some people may not even be able to go outside due to so many sensory issues that they must stay at their home indefinitely, right? So it just shows that it's important to assess each case individually. The employer must meet accommodation needs, but not preferences. Although there is nothing that prevents them from going above and beyond the minimum threshold and being an employer of choice. So we are seeing employers that go above and beyond, which is great, that have discussions with the employees. What is best for you and your condition? Not even, looking at medical notes, etc., really focusing on the human and how to support them best, right? So that is something that can be done, but legally they're only required to meet the minimum reasonable accommodations. I mentioned before that they can ask personal questions. within reasonable means, you know, in terms of how do you manage at home outside of work hours, on weekends? How do you travel? If you say you can't travel for work, how do you manage on weekends? There are all these kind of questions that you sometimes have to be prepared for, but this is where it's important to talk to legal counsel or the union or some sort of representative you may have to see, you know, is this something I need to actually share or disclose to the employer? Okay. An employer also does not need to comply with what is in the medical note per se. I mentioned this, right? I've seen this multiple times, probably hundreds of times in my career. Candice must work from home, period. I mentioned this before. What are the functional impacts? What are the functional limitations? What are the risks? What is the issue at work that prevents them from working in the office? This is why detailed medical notes, if required, are best to avoid this issue. I also mention in terms of bias, because these are examples I've seen in my career. And this is what I talk about bias or generalizing the migraine condition. I'll give the example. My partner has migraines and doesn't need such accommodations. You must be exaggerating your condition. I've heard this and I've seen it in my career. So this is what could be viewed as an overgeneralization or biased kind of opinion. Slide 9, next slide. Thank you, Kaylee. So in terms of healthcare providers, you know, I did mention that medical notes are not always required. We're shifting away from this, but that doesn't mean that you don't have discussions with your medical practitioner at times, right? It doesn't mean that they need to write a note, but at least they're aware of the true impacts that you're facing in the workplace, right? So it's important to provide information pertaining to your functional limitations and impacts and not necessarily medical diagnoses. I know that in the future, I just don't know when, I hope to provide a session to neurologists and medical practitioners to help them understand what functional limitations are and how that can be applied in the medical note. So I hope to do that in the future, but in the time, you know, for the time being, here are some tips that you can share with your practitioner if needed. It's important that they focus on describing functional impacts and not the medical condition per se. An employer doesn't need to know that your arm can't be raised further than this percentage in most situations, right? They just need to know that you're having difficulties moving your limbs, which causes X in the workplace, right? So I give the example again here. Patient has chronic migraines and cannot work full days in office, must work from home, period. This is a standard medical note that we've probably seen or had our doctors write at some point, right? The best practice would be patient has a medical condition where synthetic light exposure can trigger ocular episodes and visual distortions. Working in a controllable light environment or closed space with controllable lighting may reduce these symptoms. So this is more detailed and it allows the employer to look at solutions. As an employer, do I have a closed office setting? Can I offer dimmable lighting? If not, maybe working from home is the appropriate accommodation, but maybe we're about to build a new office somewhere in the same town. Maybe we can ensure that there are spaces available for people. And then maybe this person can work in the office. So these are some of the examples. So I refer to that here. Medical practitioners or healthcare providers, it's important that they support collaborative workplace integration. So if you've been off work for a while, you're going back, it's important that they support this integration if they feel that you are well enough to return to the workplace. And like I said, it's important that they offer relevant workplace focused guidance when appropriate. So guidance, but it's never just because a practitioner says X doesn't mean that it will necessarily happen in the workplace. That's something to keep in mind. Next slide. So I mentioned here, and I repeated this, but some sample strategies to assist with a lot of the general symptoms that people with migraine or headache disorders may have. To find ways to modify or reduce noise in the workplace. That could be closed offices. It could be corner cubicles in some places have low sensory zones. Some workplaces are creating that, which reduces the lighting, sound, etc. It could be using certain screens on top of your cubicles if you don't have a closed office, non-fluorescent versus natural lighting, dimmable lighting, working, I say in the dark. Obviously, it's not healthy to do so, but like limited lighting. There's also closed offices, focus rooms, or telework, right? And this is where flexible work hours, schedules, remote work options may occur. So there are two scenarios, and these are very, very basic, but I thought I would just ask, and I guess through the chat if people wanted to share, and if you don't feel comfortable, that's fine. But sensory sensitivities in the workplace. I'm just wondering, what kind of solutions, and I gave a few here, but what kind of solutions do you think are possible in the work environment to limit sensory sensitivity, such as lighting, such as screens, such as loud sounds, and so forth? Are there any examples other than what I mentioned that you can think of? And it's okay if there are not any, but feel free to include that in the chat. I mentioned the scenario 2, flexible scheduling for episodic symptoms. So this is where it can be tricky, but for best practices in my field, sometimes if you're in a role that can be done remotely at times, sometimes the recommendations we make are to offer a very flexible workplace schedule, meaning that you aren't forced to show up in the office Monday, Tuesdays, that you base it on how you're feeling that week. We all know that with migraine headache conditions, you can have flare-ups. I've personally had flare-ups that lasted 3 months, and it was very difficult to physically get into the office space. It can happen. So talking to the employer and trying to find solutions, does it mean that I work from home, temporarily for 3 months, or does it mean that I go in when I can if there's office space available for me, and vice versa? Okay. There's also questions to ask yourself when thinking of these. Are these safety or secure positions? Is it shift work? Because if you're in shift work, it may be more difficult to accommodate, especially if you can't have modified shifts. The impacts on the workplace, so that's limited, because just because somebody is not happy that they are higher seniority and now you have the preferential shift because of your condition, that doesn't, or it isn't important in that context. But the impacts on the work, like, can you still complete the work with these accommodations? Also, I mentioned before, smaller or larger workforces or workplace do impact what can be offered in terms of accommodations. From my experience, the larger the workplace, the easier it is to accommodate. The smaller, the more difficult it is. Okay. In terms of templates and resource suggestions, they are offered in the takeaway document. Kaylee, I'm not sure if it's been posted on the website or how that's going to be shared. Okay, well, I think it's going to be shared later. I don't know. Feel free to talk, Kaylee, if it is, or jump in. And I think, next slide. So the key takeaways today, and I know I went through this quickly. I wish I had more time, but like I said, it can take several years to build this kind of expertise. I'm just trying to give you the tools so that you can appropriately, manage the accommodation process for yourself in the workplace. So key takeaways that migraine and headache disorders do require flexible accommodation approaches. They vary, right? So there's not a one size fits all approach. It needs to be individualized, and your employer needs to respect the fact that it needs to be individualized in most cases. Keep in mind that the duty to accommodate is a shared responsibility. Everyone needs to participate in it, employer, employee, and open and clear communication is essential. Clear communication meaning be clear on the functional impacts. How is this preventing me from accessing the workplace? Why am I having difficulties accessing the current tools that are available in the workplace? What are potential options for me to alleviate those impacts or those barriers to fully accessing the workplace?